Hello, healers. My name is Ben, and this is the Moss Report. I'm here today with my father, author and founder of the Moss Report, Dr. Ralph W. Moss. Good morning, Dad.
Good morning, Ben.
So I understand you have some information for us about fasting and cancer, and in particular, a Ramadan-style fast and cancer. I'm looking forward to learning something from you. What have you found?
Well, as you know, I was diagnosed with diabetes about 7 or 8 years ago. And that following year, I was diagnosed with prostate cancer. So I had to quickly change my diet. And what I discovered is that a form of eating would be very beneficial in terms of both of those conditions. First, for the type 2 diabetes, it took me from extreme case of diabetes, where if people are familiar with the numbers that are measured in the blood of sugar, it was almost 400 milligrams per deciliter, which is extremely high, so high that I had to be rushed to the emergency room and put on intravenous fluids. And at that one time, they gave me insulin and so forth. And within a few months, I got that down to under 100. And it's really been, my sugar has been either normal or what they call pre-diabetes for almost all that time in the last 8 or 9 years. So I didn't invent this program. It was actually Dr. Bernstein's book on diabetes solution that guided me through this. Plus, I had known Dr. Robert Atkins, the formulator of the Atkins diet. So my thoughts went towards him, towards the very low carbohydrate diet with exercise. And that's essentially it. I haven't, since that first day that I was diagnosed, I've never taken insulin. I've never been on metformin, the main oral drug for diabetes. And my sugar is, as I say, I'm not diabetic anymore. I am still pre-diabetic, but my doctor is very pleased. My A1C is in the pre-diabetes range, not in the diabetes range. So I'm not 100% better, but on the other hand, I have had no symptoms of the diabetes, no negative long-term effects and so forth.
So your pancreas does produce insulin.
Yes.
I don't mean to
No,
question the diagnosis, but how really do you even know or say that you have diabetes, or you don't say that anymore?
I don't. I'm in remission of the diabetes, but I could bring it back in a day or two if I wanted to. I just have to go back to the high carbohydrate diet that I was eating for years.
Yeah.
So it's they say that, that when it comes to yourself, they say N equals 1, meaning that the number of people in the experiment is exactly 1, namely yourself. And so from my own personal experience, I found that it was almost unreal, the power of this type of diet. What I then realized was that you also have to limit the amount of time within which you're eating. So rather than fast for a full water fast, let's say for a day or two, which I find very uncomfortable, I adopted intermittent fasting, extending the normal nighttime fast when you're sleeping, or just limiting yourself eating within a window of time. And the window of time could be as little as 8 hours or as much as 16 hours. In other words, you could eat in an 8-hour period, 9 to 5, let's say, and then from 5 p.m. until the next morning, not eat anything, only drink water and non-nutritive beverages. So that would be a typical, I'll call this a Western style intermittent fast. And I started this when it was almost unheard of, not because of me, but just the way things went. It became very popular, and a lot of people are doing that or some version of that. And if you look at the numbers of papers even on intermittent fasting, you'll find a tremendous increase in the amount of research and interest and medical interest in this and so forth. But what I came across recently was a paper on a different kind of intermittent fasting. And since, as I say, I'm still in the pre-diabetes range, I wanted to explore that. Of course, this is a channel mostly about cancer, and I've had prostate cancer. And there too, my numbers are the same kind of thing. They're not perfect. They're not exactly where I want them to be. They're not alarming. I was told by a urologist recently that I have
These are the
nothing.
PSA numbers.
Correct, the PSA number. And my doctor and I are sort of watching that number. The two things are connected. This is the key, probably the most interesting finding ever made about cancer. If we wanted to, nail down like maybe the number one paper, the number one discovery was made exactly 100 years ago by a German scientist named Otto Warburg, who found that cancer cells and normal cells are quite different in the way they feed themselves. And that, to put it very simply, that cancer cells are sugar junkies. They really crave and need a lot of sugar. And then their whole way that they use that sugar is different from the way that normal cells eat. Normal cells feed themselves. So we don't have to go into any, you know, biochemical details on this.
Just one little question. Is that the result of the cancer cells that are trying to multiply so quickly and therefore they need all that sugar for that energy to divide?
There, yes and no. They certainly do need a lot when you think of all the things that cancer is doing and how active it is, and oftentimes, not always, but oftentimes. So they do have huge energy requirements. But the main mechanism by which normal cells feed themselves is called the Krebs cycle. Krebs was the number one student of Warburg. He also won the Nobel Prize, Krebs, for the Krebs cycle. Warburg won Nobel Prize for discoveries like we're talking about. So the cancer cells are lacking in the ability to use the normal Krebs cycle. So they have because of that, anywhere up to a 16 times greater need for sugar just to make up for that deficiency. So the appetite of cancer cells for sugar is enormous. And this now brings us right back to the question of the diabetes, because with diabetes is an excess of sugar. It's detected by an excess of sugar in the blood, but it's also like a deficiency on the part of the cells that they don't respond to insulin. And both of these things go back. A lot of cancers and almost all type 2 diabetes go back to a lifestyle that is extremely detrimental to health. And I did both of these things, namely eating too many carbohydrates, especially refined carbohydrates, and secondarily, sitting around, having a sedentary lifestyle. Well, nothing's more sedentary than being a science writer. You're sitting to do your research, and then you're sitting to write up your research, and sitting to watch the television at night or whatever else you do at night that's not active. So our bodies are not meant to just sit around. I mean, they're built to be active, and that's a constant struggle under modern day conditions. And there are, of course, many other things.
You personally fast as part of just your low carb diet and as part of your way of keeping your metabolism in ketogenesis. Is that right?
It has been at times in ketogenesis, and I have a meter to monitor ketones in the blood, which is a substitute fuel for the body when there isn't enough glucose to be had. But I don't want to be in ketogenesis all the time. It requires eating a lot of fats. It's kind of an unbalanced diet, which you can do in a short term, but I wouldn't advise doing this, long term. I'm talking about 10 years now that I've been dealing with this almost.
And ketogenesis is the long name for what is now known as the keto diet, right?
Correct. Correct. And it's become very popular. It's in, all the supermarket checkout stands. You see the headlines. I read a paper. This kind of blew my mind. Most people on planet Earth have heard of Ramadan, and they're aware of the fact that people of the Muslim faith fast for a month every year. There's probably over 1 billion people who are fasting in this way. And I read this paper. It basically made me realize this is intermittent fasting. Ramadan is intermittent. How is it intermittent? In Ramadan fasting, you're not allowed to eat between the dawn and the dusk. So you have two meals, light meals, which is you have a meal before the sun comes up, and then you have a meal to break the fast after the sun goes down. Well, that's a pretty long period of time that you're not eating anything. Um, and and that's the first thing. So that's intermittent fasting, but it's exact opposite of what I've been doing in one sense, in that what I've been doing is eating uh, eating as late in the morning as I can get away with, and then cutting off my food as early in the afternoon or early in the evening as I can get away with. So I'm fasting during the nighttime hours, and in Ramadan you fast during the daytime hours. So why would that matter? Because you're burning energy during the daytime, you're active. So the fast, in my opinion, and this was the opinion of the authors that I'm going to show you, it's more efficient because you're going to have a deeper fast when not when you're sleeping, when you have very little energy requirements. You're going to have a deeper fast because you're going to fast during the time you're most active. This makes sense to me, and I want to try it.
So you're going to not eat food. Are you also going to not drink water during the
No.
day?
So this is the thing. I mean, I'm 80 years old and I tend to be dehydrated anyway. And and so I am going to drink water. I'll drink mineral water, my normal drink of choice. And I'll drink that during the day, however much I want. In fact, I'm going to be very careful to stay hydrated. I'll take my normal vitamins and supplements that I take. Ramadan is a dry fast. I'm not doing a dry fast. Now, maybe that would affect the efficacy of the diet. I don't know. I have no idea, but I'm not that adventurous that I'm going to deprive myself of water during the entire course of the day, especially living in a warm climate. There are some other things I'm going to change in terms of, so I wouldn't say this is the Ramadan diet. First of all, this isn't Ramadan. Ramadan is a religious holiday, and I'm not
Do
tying
you
this
do
in.
you know the origins of the intention behind the Ramadan fasting? Is it a
I've
health?
looked it up. As far as I can tell, I'm sure we'll get letters about this, but as far as I can tell, it was entirely religious. It has to do with the first time that the religion of Islam was propagated in the world. So I don't want to go into any more than that. But anyway, for me, this is a Western, if you will, or scientific adaptation of a traditional religious holiday. The month of Ramadan has a great significance within the Muslim religion, but I'm only doing this for health purposes.
I sometimes feel as though in the different religions there are food traditions and things of this type that maybe had origins that related back to health, but somehow just got incorporated into the actual religious practice. One would think that they stemmed from practical applications of eating habits.
Right. So I agree with you. But I'm not getting into that. I'm not going to get into anything religious here. I'm just looking at this new form. New. It's not new. It's 1,000 years old. I feel safe doing this because, as I say, literally like 1 billion people a year do this. And I've looked at the scientific articles, and they do not indicate that this is a dangerous practice at all.
And what are you
And
hoping to get out of it?
I showed the paper in question to my primary care physician. She was very supportive, very surprised me. She said that intermittent fasting is what she recommends to her patients, especially for overweight people. And she's just a conventional, doctor in a conventional practice. I said, I'd like to take some blood tests before and after to see um, what the outcome is biochemically. Look at the blood, look at the at the blood picture, at the metabolic panel, and so forth. So she said, well, we can use the test I just gave you. I just had a CBC, complete blood count, and a metabolic panel done. We'll use that as the before, and I'll give you order up another blood test for after. So we're going to look at it together. And I want to say, whenever we're talking about fasting, period, or fasting and cancer, exclamation point, um, really, you need to consult your doctors about this. I could imagine all kinds of scenarios where it was very ill-advised for people to fast while undergoing cancer treatment or in certain stages of cancer. So this is only partially a self-help thing. Don't just run out and not eat at all for 28 days. Unless you're really an expert on this, you could make some bad mistakes. So do this as I'm doing, with the cooperation of a knowledgeable physician and somebody who can run the test or give you a heads up things are not going in the right direction. But I think it's very powerful. My underlying belief and my feeling and my experience with even the amount of fasting that I've done is I'm kind of amazed at how at what the health potential is of fasting. And it's a very, very old, this may be the oldest medical procedure of all. So I want to explore this a lot more.
My question, though,
What do I hope to see?
right?
I hope to see my PSA to decrease, my lymphocyte counts go up. They've been a little low since I had COVID 2 years ago. I'm hoping to see the A1C go down, although A1C is a marker of your blood sugar over a period of 3 to 4 months. So it wouldn't go down dramatically, but I hope to move it down even more. I hope to see the fasting glucose go down because, as I say, it's now tends to be in the pre-diabetes range. I want it to be in the non-diabetes range, in US terms, under 100 milligrams per deciliter. So those are some of the things that
About
I'm looking at.
LDL.
Yeah, that would be interesting. I'm not a great believer in the primary importance of cholesterol, but I'd love to see the LDL go down and the HDL go up. Those both would be very encouraging. I'm going to look at everything, and so is my doctor. So it's an experiment, and I'm excited about it. The biggest hardship is going to be making sure that I get up and I have the food ready. I'm going to have to do, preparation work in terms of shopping and so forth. So I'm working on all that. And there's two other things I wanted to mention. I missed Ramadan, so I'm not doing this in synchrony with the billion people who are fasting around the world. I'm just approaching this as a form of intermittent fasting. I'm not doing it for religious reasons. I'm just doing it for dietary reasons. That's one thing. The other thing is that Ramadan starts with the new moon. That's to say, the phase where you can't see the moon, and then it goes to the next new moon. I'm not worrying about that. There is some mention of that in the scientific paper, but I don't see the rationale for it. And being sort of a science geeky guy, I'm only going to go with the things that I understand scientifically. So I'm not going to go new moon to new moon. And besides, I don't want to wait. I want to get going on this and start it. Correct. This was a study that started me on this quest, and it's a good journal. The people who wrote the paper, as you can see, that there's about 8 authors, and they're all from Baylor College of Medicine in Houston, which is an esteemed university. And the title is Dawn-to-Dusk Dry Fasting, which would be sort of a scientific way of describing the Ramadan style fast. They don't talk about religious aspects here, just the scientific aspects. It induces benefits in terms of the circulatory system. It's anti-inflammatory and anti-cancer. And this affects the proteins in the white blood cells, basically.
Tumorigenic is the referencing the cancer?
Correct. Anti-cancer forming proteins in the peripheral blood. The mononuclear cells are like the white blood cells, most of the white blood cells.
So they studied all of these aspects.
Yes.
In
And
human beings?
yes, patients who have metabolic syndrome, which is what I and half the United States has. In other words, metabolic syndrome means that your tendency is to have high blood pressure, high blood sugar, be overweight to obese, um, and be prone to diabetes. So, metabolic syndrome is usually what precedes a number of different diseases, very important diseases, including type 2 diabetes. It's a very, very detailed study. I'm not going to go into it. I'll just show you some of what they wrote. Metabolic syndrome is characterized by obesity, high blood pressure. These things go together. Elevated fasting glucose, triglycerides, not good to have a high level of triglycerides, and of course the cholesterol question. It favors inflammation in the body, which is not good. The risk of blood vessel, heart disease, let's say, and multiple cancers. And then they showed in an earlier study that metabolic syndrome was the 4-week dawn-to-dusk or sunset dry fasting resulted in significant changes in the proteins found in the blood and improvement in several metabolic risk factors. The white blood cells changes is a powerful tool that can provide insight into how this type of Ramadan style fasting affects protein expression in the pathways at the cellular level. Yeah, basically, they have found in their studies that dawn to dusk fasting improved almost every marker of health that you'd be interested in. The white blood cells improved, which means that you've got your main defense system against cancer within your body improves. The blood sugar goes down, meaning that there's less fuel for the cancer to grow, and other things that could also contribute to cancer, but you can die of other causes while you're fighting against cancer. It's a very long paper,
Yeah.
very, very detailed.
Okay.
If I can show you, I mean,
Can this
it
be
gets
accessed online freely, or is that a
absolutely,
subscription? Oh, yeah.
absolutely,
Okay. We'll include the link in the description, of course.
yes. And so that was highly positive. Another study, also from Baylor, talks about, I'll just go you the conclusion. In conclusion, dawn to sunset fasting has the potential to optimize the immune system function against COVID-19 and suppresses chronic inflammation and oxidative stress, meaning free radicals. It improves the metabolic profile, and this will interest you, Ben,
Yeah.
remodels the gut microbiome, remodels it in a favorable direction.
Oh, I see.
So the gut microbiome is one of the things that uh, gets harmed during COVID. And this is a way of starting to restore the gut microbiome. We talked previously about, uh, how you could take probiotics and prebiotics in order to bring your gut bacteria up to the optimum level. But here's another way that you can affect that. So we're always looking for ways to make our gut microbiome or the bacteria in the gut healthy and diverse and so forth. Well, here's one that's not about the particular foods you take, it's when you take them.
I actually didn't know that there was a relationship between COVID-19 and the microbiome, but I do know that it affected the immune system, so that makes sense.
Yes, I didn't know either. This was the first that I came across it also. And I think this is very relevant to people who have long COVID, meaning who had COVID and are still suffering after effects and symptoms. And there's a lot of those people. Here's something that doesn't cost anything that almost anybody can do, um, and try again with the cooperation of their doctor. It could be something very positive.
This particular study also relate to cancer. That is because of the fact that this fasting affects the microbiome, which then affects cancer.
Correct. Correct. We'll take a look at this sentence here. COVID generates high levels of pro-inflammatory cytokines, meaning it sets up a storm of aggressive and active and possibly destructive chemicals within your body. That's called a cytokine storm. It's a very dangerous state that can actually lead to the death of a patient. And this is what sometimes happens with COVID. And I lost two friends in that way. So I think it's if there's any way, just by adjusting meal times and the wake sleep times, this is a very simple, doesn't cost anything. The doctors should be on board with you doing this. Also, COVID leads to mitochondrial dysfunction, which is almost a definition of cancer. That cancer doesn't utilize, as I said, doesn't utilize the Krebs cycle properly. So it could promote cancers in that way. COVID generates excessive amounts of free radicals, and it decreases the kind of cleaning, the detoxification that goes on normally within cells, autophagy. And so there's a lot of, and the gut microbiome. So there's a lot of commonality between fighting against the long-term effects of COVID and fighting against cancer.
Are there larger studies in the works?
I'd have to go check within clinicaltrials.gov, but I believe that this is being actively pursued. Meanwhile, if you have cancer, long COVID, you may not be able to wait 5 or 10 years for the completion of all the studies. So if your doctor agrees, it would be something worth bringing to their attention. And I do this all the time. I go in to, when I have appointments with doctors, I do my research. I print out the papers that I think are relevant, and I bring it to them and to get their reactions. And usually, by the way, I get a positive response to this.
I'm getting sort of warm fuzzies around these two papers that you've shown me. I think these folks at Baylor deserve a hearty pat on the back
Yeah.
for doing a study of this type that's sort of unrelated to pharma, you know?
Yes, that's right. That's their problem.
Well, I just think that's admirable
It
to not
is
just be
very
doing
admirable.
research into patentable drugs, and looking
Right.
at things of this type is critically important for the development of medicine.
I agree. I have a couple of more papers, three
Sure.
more I'd like to just quickly run us through.
Okay.
So this one, again, from Baylor. The Baylor seems to have grabbed the lead on this topic, but this one is about the effects on circadian rhythm, normal rhythm of the body in terms of sleeping and not sleeping, obesity, metabolic syndrome, and non-alcoholic fatty liver disease. So this is another paper on the impact of this sort of time-restricted feeding or eating. And these are all been from Baylor.
Yeah.
This one is from UCSD, the University of California, San Diego, which is nice because if it's everything's coming from one
Right.
place, you begin to feel, well, what about the rest of the world? 19 participants with metabolic syndrome, just intermittent fasting in general,
Mhm.
improves cardiometabolic health for patients with metabolic syndrome receiving standard medical care, potentially powerful lifestyle intervention that can be added to standard medical practice to treat metabolic syndrome.
Hmm.
So,
Which
this
is
from Salk.
probably the leading health concern in this country.
Correct. Correct. Yeah,
So that's a big deal.
I believe it is. And it isn't just coming out of one institution. I could show many institutions that are researching this. And here is Fasting in Cancer from 2018, Molecular Mechanisms and Clinical um, Applications. This one came from Italy.
Mhm.
And it says, and we'll go through the abstract, the vulnerability of cancer cells to nutrient deprivation is an emerging hallmark of cancer. So, in other words,
Aha.
of course, we've known for 100 years that they say dependency on specific metabolites, meaning glucose, basically, that cancers, as I said, are sugar junkies. Fasting or fasting mimicking diets called FMDs, that's where they give you certain foods and certain supplements So you give people a little bit to eat during the time, reduces the capacity of cancer cells to adapt and survive, and thus improves the effects of cancer therapies. In addition, fasting or fasting mimicking diets increase resistance to chemotherapy in normal but not cancer cells. You get it? That
Mhm.
they resist that the chemotherapy doesn't affect the normal cells so much, but it increases or allows for the effect of the chemo on cancer cells. It promotes the regeneration of normal tissues, and this could prevent potentially life-threatening side effects of conventional treatment. But I think fasting in the way that I've discussed it is something quite doable by most people. If not, then a fasting mimicking diet is probably a good idea. But I guess the question that isn't answered by any of these studies that I've seen is Ramadan style intermittent fasting better, worse, or as good as the kind of intermittent fasting that I've been using and advocating for almost a decade? Well, I'm going to try the Ramadan style of diet, but if that's too hard for people, they could just do intermittent fasting. If it works at all, I'm probably going to do it more strictly. I might even try the dry fasting. I'll certainly try to start at the new moon and end at the new moon. So I'll pursue it further if I see some positive results from it. I think the intermittent fasting is a very powerful tool, to quote some of the papers. It's a very powerful tool. It's worked so well for me. I would say almost that it saved my life. It certainly turned it in a much healthier direction. So I wouldn't want to discourage anybody by somebody throwing up their hands and saying, I'm not getting up at dawn, which is what my own wife told me. But so it's understandable. Okay, but don't throw out the baby with the bathwater. In other words, if you're not going to do the Ramadan style of fasting, definitely look into and consider doing a fast, an intermittent fast, which is harmless, which is not hard to do. You can have your just have your breakfast a little bit later, have your dinner a little bit earlier, and then leave a nice period of time where you're not taking in any nutrition. You could have water, seltzer, mineral water, coffee, tea, whatever you tolerate normally, but don't take in calories during that period of time between your last meal in let's say, the late afternoon and your breakfast the next morning at 9 o'clock. And I think a lot of people would derive a lot of benefit from doing that. I'm just trying to take it up one more notch from that to see whether this Ramadan style or dawn-to-dusk fasting maybe works even better. So I'll give it a try. We live in such a consumer society. We think typically in terms of what can I take? And this goes against the grain, literally, because it's about what I don't take. It's about cutting back. It's about leaving a period of just letting the intestines and the systems rest a little bit, not having to be constantly dealing with food coming in, things coming in, just giving it a lengthy period of rest. That alone, I think, is a wonderful thing. So I try it.
Mhm. I have, for the past year, been attempting to stop eating by 6 p.m.
Yeah.
if I can, and not eat until 9 a.m.
It's had a great effect on you, Ben.
And I've been feeling great. I it's the first time I've really been hyper aware of my metabolism and caring for it and toning it up the way that you would any other muscle, really,
Mm-hmm.
is a key part to my success personally and my health.
Yes.
So I recommend it highly as well. All right. Well, thanks for all that info and research. For now, for the Moss Report, I'm Ben Moss. How are you healing today? Thank you for watching. We really appreciate all of the support. Please leave a like, a comment, subscribe to the channel, and visit themossreport.com. We wish you all the best for health and healing.